Hello everyone, myself Dr.UMARANI, Associate Professor in Department of Anatomy. Today I am going to discuss about that recently finished first year KNRUHS supplementary question paper. Let's see what is the question paper given in supplementary examination. It is paper 1. The paper 1 contain the head and neck, neuroanatomy, upper limb. So here the two essay questions is given from that head and neck, that is temporomandibular joint and extraocular muscles. The 5 marks question also given weight is in that head and neck region, and few questions also came from the embryology, like describe spermatogenesis. It is from the general embryology question. So here the 2 mark question. So in this video I am going to give detailed information, detailed description of the 2 mark question. So let's see that what are the 2 mark questions and their description. So first question, that is a trophoblast. So it is that question come from the general embryology. So what is trophoblast? So as a 2 mark question, so trophoblast is nothing but after fertilization 4th day, while forming the blastocyst, there are 2 distinct cell populations are arises. So number 1, that is embryoblast, and number 2, that is trophoblast. So here in this image you can see that shape blastocyst. It is that blastocyst. So in the blastocyst outer covering layer it is a trophoblast and inner cell mass, and between that two it is blastocyst cavity. So the embryoblast or the inner cell mass is located internally, and it is that developed into all 3 germ layers, and from these 3 germ layers that all the organs, tissues of the body develops. And the trophoblast is that outer superficial layer of cells, and that forms the, so these 2 forms the trophoblast. So this trophoblast later contributes to the formation of placenta. So this placenta is nothing but it is a site of exchange of nutrients and waste products between the mother and fetus. And so this trophoblast 8th day after fertilization develops into 2 layers. So those are syncytiotrophoblast and cytotrophoblast. And this syncytiotrophoblast secretes the enzymes that helps to blastocyst to penetrate into that uterine lining. So by digesting and liquefying the endometrial cells. And another secretion of the trophoblast is HCG, that is human chorionic gonadotrophin. So these are the important points about trophoblast. So next question, radial nerve applied anatomy. So this is that one of the major nerve, it is present in the upper limb, and it is arising from the brachial plexus. And that radial nerve, it is injured in 3 sites while its course. One is at that axilla, one is at that spiral groove, and one is at the elbow. So these are the 3 areas so commonly injured. When it is injured in that axilla by using that crutch, so this is known as the crutch policy, and that characteristic features of this crutch policy are injury at that axilla is mainly paralysis at that arm region. So the triceps muscle paralysis, it causes loss of extension of the elbow, and loss of extension at the wrist causes wrist drop. So in this image you can see that there is a pressure from this crutch at the axillary region, and so these are the clinical symptoms. So this is that image about that wrist drop, and that at the spiral groove So this spiral groove, when it is injured or compressed, known as the Saturday night policy. So there is a pressure on the radial nerve by drunkard falling asleep with this one arm over the back of the chair. So you can see here image. So while in this position, there is an injury of the radial nerve at the spiral groove, and the characteristic clinical feature is again wrist drop. An injury even at the elbow region causes radial tunnel syndrome, and it is compression of the deep nerve of the radial nerve at the elbow region. So these are the clinical importance of the or applied anatomy of the radial nerve. Next question is that applied anatomy of pia mater. So pia mater is nothing but it is that meningeal layer covering the brain and spinal cord, and it is the innermost in meningeal layer, and it is located underneath that subarachnoid space. It is very thin and tightly adherent to the surface of the brain and spinal cord, and it is the only covering to follow that contour of that brain, that is gyri and sulci and fissures. So the clinical anatomy of this pia mater, that is the innermost layer, it is meningitis, that is the inflammation of the meninges. So it's when the protective lining around the brain and spinal cord gets inflamed and it starts to swell, and it usually happen when that infection with that bacteria or virus infect the fluid that surrounds the brain or spinal cord, that is that which in turn inflames the meninges. So this is that image you can see there, bacterial meningitis. So this meningitis because of the inflammation of this meninges, and the symptoms may be the person becomes tired, irritable, feverish feeling, and stiff neck and headache, also having that nausea and vomiting. So these are the some clinical importance of the pia mater. So the next question, it is the thyroid blood supply. Usually thyroid is that very important endocrine gland. It is having the rich blood supply. There are that arteries which supplies the thyroid gland are superior thyroid artery, inferior thyroid artery, thyroid ima artery, and accessory thyroid arteries. Superior thyroid artery is a branch of external carotid artery, and the main thing is it is accompanies the external laryngeal nerve. And the inferior thyroid artery, it a branch of thyrocervical trunk, that is the first part of the subclavian artery, and it is intimately related to the recurrent laryngeal nerve. And thyroid ima artery, it's a branch of brachiocephalic trunk, and the accessory thyroid artery is arising from the tracheal and esophageal arteries. So these are the brief description of blood supply of thyroid gland. It can be asked as a 5-mark question. So basing on that marks, we should describe that answer. And the next question is the classify nervous system. It's a question from the general anatomy. So nervous system usually divide into central and peripheral nervous system. Central nervous system means brain and spinal cord, whereas peripheral nervous system means there is 12 pairs of cranial nerves and 21 pairs of spinal nerves. And the autonomic nervous system, this autonomic nervous system again divided into sympathetic and parasympathetic nervous system. So we'll see the diagram anatomically, the division of that nervous system. Here it is brain and spinal cord, and peripheral nervous system, it is cranial nerves and spinal nerves. So functionally this nervous system, it is divided into two, that is that sensory and motor, that is that efferent and efferent. Sensory is the efferent and motor. So in the sensory, that information it is reaches to the central nervous system, whereas the motor from central nervous system it reaches to the peripheral part. So if it is reaches to the skeletal muscle, it is the somatic in nature. It is the autonomic, so it is reaches to the cardiac muscles, smooth muscles, and glands. So these are the classification of the nervous system anatomically and functionally. So the next question, define pronation and supination. So these are the movements. These are the rotatory movements of the forearm and around that vertical axis. So what is that pronation and supination? So in a semi-flexed elbow, the palm if turned upwards in supine, that is in supination. When it downwards, it means it is pronation. So here images you can see, when palm turned upwards it is supination, when it is downwards it is pronation. So what are the contents of superficial fascia? So when we open that dissection, the skin, superficial fascia, deep fascia, these are the three areas we can find. So the superficial fascia lies beneath the skin. Usually it is made up of loose areolar tissue and amount of the fat. So fat is absent in areas like eyelids, external ear, penis and scrotum. And the superficial fascia also contain the subcutaneous muscles in the face, neck and scrotum. Usually muscles are present in the deep fascia, but in these areas the superficial fascia also contain the muscles. And superficial fascia also contain mammary gland in the females and deeply situated sweat glands, and there are superficial group of lymph nodes also present, and some cutaneous nerves and vessels also present in the superficial fascia. The next question, boundaries of anterior triangle of the neck. So here that we can see the boundaries of the neck here. This is the base. So base is that one upper area where that lower border of the body of the mandible and the line joining the mandible to the mastoid process, it is the base. And you will have that anterior boundary, that is anterior median line of the neck, and will have that posterior boundary, that is that sternocleidomastoid muscle, that is anterior border. And when these two meeting point, here it is that apex, it is like at that suprasternal notch, when that posterior boundary and anterior boundary meeting. So these are all boundaries, that is that anterior, posterior, base and apex. So this is total, this is about that anterior triangle of the neck. And anterior triangle of the neck again having that triangles, digastric triangle, submental triangle, muscular triangle and carotid triangle. So there are 4 triangles are present in the anterior triangle of the neck. So this is about the boundaries of anterior triangle of the neck. Next is that question, branches of the common carotid artery. So here in this image you can see that arch of aorta. Arch of aorta is having that 3 branches, brachiocephalic trunk, then common carotid artery right side and the left subclavian artery. So in that brachiocephalic trunk again divides into right subclavian and right common carotid. And here the question is what are the branches of common carotid artery? So the common carotid artery, the branches will have that two common carotid arteries, that is right and left. And so the right common carotid artery is arising from the brachiocephalic trunk at that sternoclavicular joint, whereas left common carotid artery arising from the arch of aorta. So here the branches of these common carotid arteries are 2, that is that external carotid artery and internal carotid artery. So then external carotid artery supplies to the head and neck phase, whereas internal carotid artery, it enters into the brain and supplies to the brain. So next question, name the cartilages of the larynx. That is larynx is also known as the voice box. So it is made with that cartilages. It is having that 3 unpaired branches and 3 paired branches. Unpaired branches are 3 in number, thyroid, cricoid and epiglottis. Paired branches are erythenoid, corniculate and cuneiform. So these are all cartilages of the larynx. So these are the 2-mark question and their solutions, students. The same way you can prepare notes of that essay questions and short questions. So thanks for listening. Thank you very much.